And in males, another problem is quite commonly it is seen that they start coping by using substance.
Yes, it's coming to that.
That worsens the situation in the family. See, as we already discussed in previous our interviews or presentation, that infertility is basically a couple issue.
Yes.
So it's not just a female who faces the psychological burn, it is male also who faces, who gets the feeling that he's not becoming the father. Okay. So he also feels the similar things like a female. Now, how will he present? What will be his coping style? These are a bit different from females. Okay, not in all the cases, but in most of the cases. In most of the cases, why? Because of the social issue or social background in our society. See, in our society, it is said that male has to be brave.
Yeah.
He cannot cry. Okay, that doesn't mean that he doesn't feel emotion. Only thing is he is not allowed to express his emotions. Okay, that makes the things more difficult for a male.
Yes.
Okay. Now, how will he feel? What will he feel depends on many factors. His own psychological makeup, or his social surroundings. Now, social surroundings means what? His relation with his wife, other family members. Psychological means usually what are his coping ways? How does he cope with the emotional issues that come in his life? I will again share one of my case in this thing. So this was a case who was on treatment for anxiety, who was basically diagnosed, whose diagnosis was anxious personality disorder, anxious avoidant personality disorder. He and his wife, they were undergoing this thing, IVF treatment purpose. Now, wife started the treatment, psychological treatment, in which she started going for mindfulness-based therapies. This husband, he was not going for any treatment, but gradually what happened? He started developing episodes of panic-like symptoms. And typically just before the expected date, like when they were expecting that she might conceive. And at that time, he used to start having anxiety symptom, palpitation, tremor. And if she develops another cycle or she gets a cycle, he used to develop depressive symptoms. Okay. So the grief cycle that we usually see in female, this male was going through the similar grief cycle. When I started interviewing him, he said, see, I feel very happy. I see kids of other partners or their friends. But at the same time, I feel very sad that why God has done this to me. So he was also feeling like, why it is me? That's why he started developing anxiety symptoms. Some medications were started to him because panic symptoms were quite severe. And along with that, he was referred for psychological help. Gradually, they settled down. It sorted out is a very vague term. Okay.
Okay.
What happens? He came for follow-up of medications for 4 to 5 months.
Okay.
I just tapped. I was not doing the therapy for that male partner. He was coming to me for medication. I used to just tap that how he is feeling. After 2 to 3 months or so, he started accepting it. That okay, that is one part of my life. So I should look at my life as a whole, not at just one part.
Yeah.
So medication plus psychological help, they didn't conceive even after 5 to 6 months. After that, medications were tapered and stopped, and he didn't come back to me. But after 5 to 6 months, he was sorted out that okay, at least we will see in future what can be done about this particular issue. But I should spend time in other activities of my life. So this was what was happening.
So when somebody goes through these emotions, are they susceptible to feeling like this for other problems also, or is it just a one-off case?
Okay. See what happened in psychology. Suppose, okay, I'm a doctor. Suppose today I saw 2 or 3 patients, they didn't recover or something, some mishappening happened. I'll feel sad, I will feel distressed. But next day, I will again go back to my work, restart my job. So we have a tendency to overcome stressors. But what if 2 or 3 stressors, they start coming up one to one, back to back? So what will happen? Our capability to fight with the stressors may decrease.
Yes, yes.
So these people, those who are going through this continuous stressor, their chances of developing a psychiatric disorder are higher, because there is a background in which there is a background of continuous psychological stressor or pressure that is going on, over which if a new stressor, say in his job or in his family or in his friend circle, such thing they come up, so what will happen? They might not be able to cope up because of the additional factors, addition of these two stressors at a time. So if the person is continuously feeling a psychological burnout, so he should take a psychological help at the initial phase. Otherwise, there are chances that he may require medication in future.
People viewing this video, it's important to note that there's no shame in seeking mental health doctors.
Yeah, there is no shame. See, it is a thing of strength that you are going for help.
Yes.
See, national survey says that around 10 to 15% of the people in India, they suffer from some psychological issue or psychiatric disorder at some point of their time. But how many people they go for help? Very few.
Very few.
Why? Because they feel stigmatized. They feel that nothing can be done, which actually worsens the situation.
Yes.
Now see, suppose that person would not have come for psychological or psychiatric help. What would have happened? He would have started developing some physical symptoms, pains, aches, headache, which would have ultimately decreased his functionality, number one, which could have further made him more irritable at workplace.
Yes.
So, so one should act at a right time before things get worsened. And in males, another problem is, quite commonly it is seen that they start coping by using substance.
Yes, it's coming to that.
So that worsens the situation in the family. It is better that they should go for help. It's not that always the doctor is ready to write medicine. It's not like that. They may refer you to the counselor, and things may be sorted out at the initial phase on.
Yes, yes. When people go through all these negative emotions, apart from being irritated all the time, unreasonable anger or expectation sometimes, are there any other physical symptoms? Like, for example, when people are stressed, some people get pure shoulder pain.
Yes, they do get multiple pains and aches. See, I'll explain it in a very simple term. When we feel anxious, or when we encounter a anxiety provoking situation, we start feeling heartbeat, our increased heartbeat, or we start feeling tremors. Why? Our eyes have seen a danger, our hands have not seen. What happened? When our eyes see a danger, it sends signals to the brain, and brain releases chemicals, stress chemicals. Now, what happens if a person is continuously under pressure or under stress, which is usually a case in cases of infertility? Continuously stress hormones will be released, which will have a damaging effect on every part of the body. Okay. It causes muscular pains and aches, number one. It causes headache, number two. Then it may sometimes even cause your gut motility may get altered. Few people, they get constipation. Few people, they get a repeated urge to pass stool. Okay. Few people, they start having pain in abdomen. So chronic stress can cause lot of your physical problems. Few people, they get skin problems like acne or these things. Continuous stress can lead to hypertension
and hair fall.
Yeah, can cause. Sleeping disorders happen. To sleep, your mind need to go into relaxed state.
Yes.
If throughout the day you are stressed up, you might not get sleep. And some people, they complain that I sleep, but my mind is never asleep. It is always like something going on when I am asleep.
Yeah.
So when they get up, they don't feel fresh. They feel tired still.
Yes, yes. I understand this part. Dr. Rahul, many times over these months of different interviews, everybody talks about stress and how stress is a very negative impact on infertility treatment. But stress is present in our lives.
Yeah.
How do we deal with stress?
See, stress is a term that we have given. Now, suppose I get up in the morning. One thing is, I have a plan. When I get up, okay, I will get up, I will get ready. I will get my son ready. I will drop him to the school. But these are the tasks. Now, whether I enjoy it, if I enjoy it, I will be happy. If I take it like a task, I will feel stressed up. Now, either I should not do all these things, but then the life will become very boring.
Yes.
Okay. So it is your perception about the situation that determine whether a situation is a stress or whether there is something fun in it.
So it's all here.
Yeah, it's all here. For example, I usually ask this question to my patients, although this is not a patient type interview, but I usually ask this question to my patient. Suppose, usually to students who are coming for the treatment. Suppose a teacher comes to your class and she asks that, okay, after half an hour, you will have a surprise test of whatever has been taught to you up till now. What will you do? Some children, they say that I can't do anything. In half an hour, it is very difficult. I may just lose my mind. I may freak out. Few children, they say, yeah, it's okay. Let her ask. What will happen? Maximum she will fail. Nothing more. Few people, they say, yeah, I still have half an hour. I will just talk to my friends. We will sit in a group. So we will just think that which all questions Miss has told are important. We'll just go through them. Now, situation is same for three of them, but how they take is different. Similar is the situation in our life. All of us are working. Now, how you take your work determines whether you take your work as a stress or you enjoy it. Little bit of stress may happen sometime, but it should be little bit.
Yeah, and a little bit of stress is, I think, not a bad thing. Otherwise, you tend.
Yeah, little bit of stress it may happen. For example, suppose I am in my OPD.
Yes.
Okay, and 2 o'clock is my lunch, and suddenly 4 or 5 files come at say 1:30. I may feel a bit stressed, but it's okay. I can initially I would have seen the case in 20 minutes. Now I can finish that case in 10 minutes also. Little bit of stress is okay. But then the point is, if you feel that you have not done justice to your work because of time pressure or stress, then you should tell that person that, okay, today because of time constraint, I'm not able to do it properly. So you can come tomorrow or we can clarify these things next time. It means pressure was there, but you channelized it properly. It all depends on your coping skills.